Hi, my name is Russell Peterson, and these are my top 10 important events and that were a part of the U.S. healthcare system and like the whole timeline and all that. My first one is the 1798 establishment of the Marine Hospital Service. This was the first federal health law in the United States. It was mainly aimed at providing medical care to sick and disabled seamen. It laid the foundation for the U.S. Public Health Service. So for that whole time period, that's pretty much where that took over. And then next is the next one I have is the 1846. That was the year, like the beginning of anesthesia, the first successful use of ether anesthesia by Dr. William Morton happened in a surgery and revolutionized medical practice by allowing pain-free operations, and it significantly did help with it when it comes to advancing surgical procedures. And then after that time period, we have the 1906. In 1906, what was that? The Pure Food and Drug Act. This act, I think that act aimed to regulate the labeling and safety of food and drugs. It marked the beginning of the FDA and was crucial in ensuring consumer protection. And then after that was the 1935 Social Security Act, and in that act, it included provisions for like public health and welfare programs, laying the groundwork for future healthcare programs like Medicare and Medicaid. And then after that one was the 1946, the Hill-Burton Act. That act provided federal funding for the construction of hospitals, which helped to expand healthcare infrastructures and across the United States, especially in underreserved areas. Yeah. And then after that, we have the 1965, the creation of Medicare and Medicaid. Those two programs provided health insurance to the elderly and low-income individuals, respectively, significantly increasing access to healthcare services for these populations. Yeah. So, and then after that, in 1983 was the introduction of DRGs, diagnosis related groups. This system of hospital reimbursement under Medicare aimed to control costs by paying a fixed amount for specific diagnoses, changing the way hospitals usually manage to care and finances and stuff like that. And then after that was the 1996 Insurance Probability and Accountability Act, also known as HIPAA. This act was what provided data, privacy, and security provisions for safeguarding medical information, which became increasingly important with the rise of digital records. Then getting to the 2000s area, we have in 2010 Affordable Care Act, the ACA. This comprehensive health care reform aimed to increase health insurance coverage, reduce costs, and improve healthcare outcomes. It included provisions like the individual mandate and Medicaid expansions. And then finally, I have in 2020 the COVID-19 pandemic response. So basically, the U.S. healthcare system faced unprecedented challenges during the COVID-19 pandemic, and that was what led to rapid advancements in telehealth, vaccine development, and public health infrastructures. So, yeah, that's pretty much what I got for